answer to your question, Adam, is yes. So we are. And I have 1:15 straight up, so we will go ahead and get going. Welcome everybody to our weekly news briefing on all things regarding the COVID pandemic with Monroe County, the city of Bloomington, Indiana University, and Indiana University Health. We will begin with opening comments before we open up for questions. We'll start first with Bloomington Mayor John Hamilton.
Thanks a lot, Chuck, and thanks for everybody being here. Just a quick local update on the city. We tested 2 employees positive this week compared to 4 last week, so we're pleased with that, though still a concern. Our utilities testing program continues. Last week I reported we had one of our plants had a non-detect under 10 gene copies per 100 milliliters, and the other had 38. Now this week we have a flip and one non-detect and the other 28. So actually I'll take that as good news overall, a little slight reduction. Our $100 incentive is still at 63%. I just want to note, President Whitten said recently, described IU campus as among the safest place to be in the state. That's true of our community as well, in the sense that we're in the top 4 out of 92 counties in terms of that rating. The bad news is we are getting riskier and the spread is increasing. I try to give images, just one image. The state daily death rate in most of July, you could count how many people died in our state on one hand every day, 5 or fewer. And now you need both hands and both feet to count the average daily loss, 20 people. Those are people with names and families, and that 4-fold increase is a dramatic indicator of the stakes involved in this, the importance of vaccinating, the importance of using our masks, the importance of testing. And I know we'll hear about testing locally as well. Staying home if you're sick, don't share air if you don't have to, outdoors better than indoors, and particularly just protecting those who cannot protect themselves, thinking about all of our young students in elementary schools who are not getting vaccines, our immunocompromised city members, residents of our community. We need to do the right thing. We need to mask. We need to county, our community, our campus among the safest places in the state. We're just not out of the woods and need to keep doing what we're doing. So I'll be happy to take questions at the right time. Back to you, Chuck.
Okay, let's check in with the Monroe County Department of Health and Penny Caudill. Oh, still muted there, Penny.
All right, I guess I'm out of practice now that we're back every week, right? So got me out of practice. So welcome to fall. I wish I could say that we were welcoming falling infection rates, but we're not. We do remain in a yellow advisory, 1.5, with 220 cases per 100,000 and a weekly positivity rate of 4.34%. I do want to note, however, if you look at today's positivity rate, it is 5.4%. And if that were our weekly rate, we would not be in yellow, we would be in orange. So our numbers do continue to rise. What we do have going for us this year is vaccination. As of today, we have 58.7% of our population who's eligible for vaccine, who's fully vaccinated, and 57.6% have received a first dose. Now, that is still not where we want or need it to be, but I am pleased to say that we are seeing those numbers increase a little bit quicker than they had been. It had been really slowing, and we were spending days before we would see even a little bit of an increase. So I'm pleased that that's increasing. In terms of testing, we are disappointed that we are still awaiting the opening of the community testing site. We are still working with the state to do that. So rest assured it will be open as soon as we can make that happen. It is just, we obviously did not plan for the right kind of target date, but we are working on it and it will be open as soon as we can get it done. Last weekend, the big thank you to Cook Group for allowing the use of their property so that the Department of Health could do a mobile clinic last Friday and Saturday. So they were busy. They were not overwhelmingly busy, but they did have steady people in line ready to use those services. And so we are pleased about that. In Indiana, we are seeing a rise in infection among our 0 to 39 age group and a rise in pediatric hospitalizations in the state. Deaths, we are seeing an increase in deaths in the age group of 50 to 59. So if you were watching those, that dashboard, you can see those things change. But breakthrough cases are less than 0.6 of fully vaccinated individuals. So vaccine is still very, very important. In terms of schools, the governor did put out a new executive order. It did clear up a little bit of confusion over local authority still being in place. And it also allows for some changes within schools as a means to reduce the number of students out of class regarding quarantine. No local decision has been made regarding that at this time, but the Board of Health is scheduled to meet next week. They meet on September 8th, and they will discuss the regulations at that time. No need to wait, vaccinate. Visit ourshot.in.gov to find a vaccination site near you. Miller Drive has Moderna Mondays, and they are expanding options for vaccinations as well. Vaccination and testing mobile clinics are occurring across the state. They are in Brown County and Putnam counties today and tomorrow, noon to 8. You can visit the state website for details and other options. There are other locations available as well, vaccine and testing. So please take advantage of those opportunities, whichever it is that you need. Thanks, Chuck.
Okay, let's next check in with the Monroe County Commissioners and Julie Thomas.
Thank you so much, Chuck. It's great to have this community update every week. I want to remind everyone to sign up for the resident alerts at co.monroe.in.us. Click on the megaphone and sign up. And when we get our testing site open, we'll put that out there and you'll receive it via text, email, or phone, whichever you prefer, or all of the above. We continue to offer the Township Assistance Fund. The Board of Commissioners and the County Council work together to provide funding for residents who are struggling to meet their basic bills, things like rent and utilities. Contact your township trustee. Every resident of the community, whether they live in the city, a town, or not, lives in a township. And that trustee contact information can be found through the emergency management webpage at co.monroe.in.us. We know that COVID-19 has been exhausting for all of us: grief, anxiety, work, stress. What can we do? Well, we appreciate the excellent care offered by our community's health professionals, the essential workers who keep our economy going, the health department and health board for protecting us and looking forward and looking ahead and being thoughtful about that. But we can do something. We can get vaccinated. We can encourage others to do so as well. We can wear a mask when we're out in public to protect those who cannot get a vaccine and to protect ourselves. And a big thank you to those who did get the vaccine and have been vaccinated and those who are wearing their masks. You are making a difference. It can be difficult to be positive in these uncertain times, but please be respectful and be kind, because that too can make a difference. With that, we'll take questions. Thank you.
Okay, let's next check in with IU Health and Brian Shockney.
Good afternoon, everyone. Thank you for joining us. As we've reported over the past few weeks, our numbers of COVID-19 inpatients across the South Central region during the past week continue to rise to concerning levels. The numbers here in Monroe County between IU Health and Monroe Hospital are also concerning, as you can see in this graphic. Our IU Health South Central region COVID inpatient numbers are following an upward trend, putting added stress on our resources and on our team members. And as demonstrated in this graphic, this influx of COVID inpatients is predominantly unvaccinated, as only 10% of our COVID inpatients have been vaccinated. And of the vaccinated individuals who did need to be hospitalized for COVID, none of them are in our ICUs or on a ventilator. This demonstrates the power of the vaccine. As the COVID-19 surge continues to push the limits of healthcare facilities, we started looking at states with low vaccine rates and how do we compare with some of those states across the country. So Alabama, Georgia, Texas, Florida, Arkansas, others showed less than 10% availability of intensive care beds. According to the Department of Health and Human Services, across the country, only 20% of critical care beds were available as critical care units continue to be inundated with the impact of the seriously ill COVID patients. And as we heard just previous here, that these are younger patients that are filling up our ICUs. Here in Indiana, we are aligned with the national average of about 20% of our beds are available. The availability of beds moves up and down on a daily basis, but we are being stretched. In addition to hospitals and critical care units seeing an increase in patients, our emergency departments and outpatient clinics across the community continue to see an uptick in individuals seeking care. We are seeing record numbers of people in our emergency departments as they are seeking treatment for COVID symptoms, but also testing. One way we're asking you, the community, to help with our hospital numbers is by ensuring they get the right level of care that you require when you need help. So by knowing where to go for your illness or injury, you can keep emergency department beds open for those who are having life-threatening issues and ensure your timely care for non-emergent conditions at our outpatient sites. So as a reminder, our walk-in sites have expanded their hours to include Sundays, which is shown on the screen. These offices can treat primary care related non-emergency conditions when you can't see your primary care provider. Remember, no appointment is necessary and COVID testing is available for those with COVID-19 symptoms. Thank you for continuing to support our healthcare providers and those on the front lines, and I'm happy to take questions at the end.
Okay, and that graphic about nowhere to go for care is now in the chat if you want to download that as well. We'll next go to Indiana University. We'll first check in with Kirk White and then Aaron Carroll, who is joining us this week. Kirk, your report.
Well, good afternoon, everybody. We'll give you the numbers first here. We're holding pretty steady on our vaccination rates. In fact, up just a little bit, a few points from last week, tenths of a point. We're at 91.8% for the Bloomington campus across the board. So that's students, faculty, and staff. We have, as we switch to our positive COVID cases, all on the Bloomington campus, the total this past week has been 91 cases. 78 of those were students and 13 were faculty and staff. Now, of course, that's up from 68 total last week, but you'd expect that with the influx of students, faculty, and staff now that we're just finishing our second week of classes. So that's still a very low number when you think about a population of 55,000, including our faculty and staff. To just have 91 cases is a pretty good percentage. And so as we look over the next couple of months, we'll be continuing our mitigation testing, our symptomatic testing, and our voluntary testing. All of those will continue to be available. We're continuing to tweak things so that we have plenty of capacity for all that. And we will have flu vaccination clinics available this fall for students, faculty, and staff, as we normally do. But we've ordered, so far, we've ordered 10,000 doses of flu vaccine, and we'll have that available for students, faculty, and staff at the Bloomington campus. Details yet to come, but we'll be kicking that off in late September, early October. And that concludes my report. We'll be ready for any questions. Thank you.
Okay, and we'll next go to Dr. Aaron Carroll, Chief Health Officer for Indiana University. And Aaron, with those numbers, where do you see things right now?
So first of all, thanks for having me. I'm just going to add a tiny. Kirk really covered, I think, most of what we would normally say, which is, great. We are continuing, of course, to make sure that symptomatic testing is available. We've been doing a lot more symptomatic testing this year than we ever did last year. Of course, the vast majority of people testing still don't have COVID. There's a lot of other viruses and illnesses going around at the moment, which complicates everything. But the numbers of cases of COVID on our campuses still remain, reasonably low compared to what I think is going on in the community in the rest of Indiana, especially given that, many of our students are clearly in a higher risk spread category with the way that they are, what they're doing and how they spend their time. We're continuing, of course, to offer voluntary testing, and we're still running asymptomatic testing that's mandatory for those who are unvaccinated. The background positivity rates have been quite low, even amongst the unvaccinated. So, bottom line, I think, is that the measures that we relied upon last year and then pushed for this year continue to work. Vaccination works. Very high levels of vaccination does work. And continuing up a lot of the other safety measures that are in place, both with masks and with testing, are continuing to hold the line. We're continuing to be optimistic as we move forward. And like everyone else, I'm happy to take questions.
Okay, and we will take your questions. And one quick note, Dr. Carroll has an out at 1:45, and so I'll try to direct questions his way first. And he will be with us weekly as we continue doing these weekly, but will be out next week for those of you keeping the scorecard at home. So if you I actually don't see any questions in the chat right now, so I'm going to actually do an early vamp in the process here as we get ready to take questions. Happy to take them now. Here's one. Dave Askins, the B Square Beacon. This one, next week's Saturday game against Idaho will be the first home football game of the season. Has the university restricted the number of tickets sold for the game? What can you tell us about pandemic regulations that will be in place, proof of vaccination or mask? Kirk and Aaron, I'll throw that out to both of you for those two parts of that question.
Well, in fact, I was just looking at instructions for game time next week. Looking forward to that. Of course, we Hoosiers will be kicking off at Iowa tomorrow to start the season, but we'll be hosting Cincinnati on the 11th, and I imagine that's what Dave's talking about. Let's see. Cincinnati, that's not till it's later in the month.
Cincinnati
Idaho
is the second game. Idaho is the first one. Cincinnati is sold out as of today, by the way.
There you go. Well, we're since the game is outdoors, this is a much less risky environment, and so we're not restricting ticket sales. But of course, we're going to encourage people to mask as they are comfortable. And Dr. Carroll, I'd pass that along to you in general terms about how we're guiding university events throughout the university system, throughout the state.
So, of course, outdoor things are always safer than indoor things. And so the fact that this is outdoors already provides for a reasonably high level of safety. In fact, throughout the pandemic, transmission in outdoor events has always been significantly less. Again, we're relying also amongst our own constituents on very high levels of vaccination, and that students, faculty, and staff, especially in Bloomington, are vaccinated at very high rates, which should also provide a high level of protection, not just for them, but for those around them. There is no outdoor mask mandate guidelines, but certainly we encourage anyone who is further concerned above that or wants an ever added level of safety to mask up. Safety, as I like to say all the time, is not binary. The more you do, the better. High levels of vaccination make it safer. Outdoor makes it safer. Wearing a mask will make it safer for you. Wearing a better mask will make it safer. A surgical mask is better than a cloth mask. K95 is better than a surgical mask. And people should do whatever makes them feel comfortable with respect to providing their own level of safety. But in general, we're not screening people at the door for vaccination, nor are we policing what people are doing individually. We hope that they will do whatever they need to do to keep themselves safe.
Next question from Dave Askins as well, and I'm going to direct this towards Dr. Carroll. Can you tell us what the breakdown of vaccinated versus unvaccinated for the on-campus positive cases is, or does the university not collect that information due to the vaccine passport prohibition?
Well, we don't, I wouldn't say like we're collecting that information, but we can, when we do contact tracing and isolation and we talk to people, we can get a sense. And I'll tell you that, breakthrough infections are occurring, but given the fact that 90+% of the population, I like to say all the time, at some perfect time in the future, 100% of cases ideally will be breakthrough cases, meaning if everybody is vaccinated, the only cases we see will be breakthrough cases. And when 90+% of people are vaccinated, some number are going to be breakthrough. I can tell you that the rates among the unvaccinated are much, much higher. That in sheer numbers of cases, I don't know what it is, but the percentage of cases, the percentage of unvaccinated people who turn up with COVID is significantly higher than the percentage of vaccinated people which turn up with COVID, which is very much consistent with everyone has said before that being vaccinated massively protects you against not only bad outcomes, but also just of infections, even if they do occur.
This next question from David Wang from the IDS. Two questions. First one for Dr. Carroll. Does IU's vaccination rate shown on its COVID dashboard reflect only self-reported vaccination statuses, or are they cross-checked with the state's vaccination records before being counted as a vaccinated individual?
No, we take attestation. Of course, you have to remember that lots of our constituents come from out of state, or are not part of what we can otherwise obtain through databases. So we are collecting data. The vast majority through attestation, or back when we were uploading data. Most people whose status we have uploaded data, but for the most part, it's attestation, which is what we can do.
And then another question, how is social distancing maintained on campus with so many people in classrooms and lining up in dining halls?
Well, it's not 6 feet, which is what it was last year. Certainly it's impossible to keep everybody at 6 feet all of the time. However, again, we have very high levels of vaccination, and we are having all basically following guidelines, masking indoors in public spaces, meaning in classrooms, and having that in the dining halls before people are eating as well. We maintain it as well as you could in a restaurant, or you could anywhere else where these activities are going on. I'd still continue to maintain, and I think it bears out on our numbers, that very high levels of vaccination plus the other measures we have in place do protect people. We do have to do more contact tracing now because people are not always 6 feet apart in classes anymore, which makes our job a little bit harder, but that's what comes of trying to return to normal as we are right now.
This question from Dave Askins, the B Square Beacon again for Aaron. Given the number of positive cases and the numbers of positive cases, is it reasonable to compute a statistic based on the number of unvaccinated people in a community? For example, we're looking now at a way more cases per number of unvaccinated people than last year when nobody was vaccinated. Is that a stat that epidemiologists can ever calculate?
It's a great question, and you could in ideal situations, but of course, collecting data on vaccinations and not vaccinations is incredibly complicated, not to mention politically and legally fraught. On top of all of that, it depends not just it depends how you spend your day as well as vaccination. Like most of our students, for instance, are spending most of their day amongst their cohort, a lot of whom are vaccinated. Faculty and staff, however, can go home to wherever home is, and vaccination rates can be incredibly different. Most cases are still likely being spread in bars, in restaurants, and in large gatherings, weddings, and things like that, not necessarily in classrooms. We've never really seen much spread in classrooms, but we do in parties and other gatherings. And of course, it's hard to just categorize how you're spending your day amongst vaccinated people, because that just is a variable that changes all of the time.
A question from Adam Pinsker at WFIU, WTIU for Aaron and Kirk. LSU is requiring fans, Louisiana State, to be vaccinated before entering their football stadium. Is this something that was discussed at IU or other Big Ten schools?
I can't speak to other Big Ten schools, but I can speak for us. I think we made a firm commitment at the beginning of the year that we were going to mandate the vaccine. And after that that would allow us not to have to do local level policing and the use of vaccine passports and anything else that was going on. So we've tried to be consistent in getting up to very high levels of vaccination such that we hope we achieve enough safety that we don't have to do this level of policing. And I'm not sure how much added benefit there would be on top of that. Again, I imagine that LSU doesn't have a vaccine mandate. I could be wrong about that. I'd imagine the state perhaps or the surrounding city doesn't have maybe the same level of safety, or that they haven't achieved the same level of vaccination on their campus that we have. But we believe that what we have in place, and that it's an outdoor gathering and everything else that is going on, makes it, safe enough.
All right. Kirk, anything to add to that for the next one?
No, I'm good. Thanks.
Okay. This one from Patrick McGurr from the HT for Brian. Can you speak to the changing calculus on elective procedure restrictions? What has changed between now and last week that led to further delays?
Yeah, so what has changed is the number of patients and the number of caregivers we need beside the bed. As we continue to see the surge and increase of inpatients that required our high level of care, we had to shift our staff from those surgical areas and other areas of our operations, including our outpatient clinics and even administrative staff, to the bedside and to the hospital, just as we did in the first big surge that we had. And so when we did that before, we shut down our elective surgeries and really are only doing emergent surgeries. We had to do that again. We actually started doing that and phasing that in a week ago, and then began this week in earnest, really rescheduling. You should imagine a lot of people were already preparing for their surgeries, so we wanted to give some time for that. I do want to say no surgery is truly elective. Nobody wants to have surgery. So this is very detrimental to our patients. And we were still trying to catch up from the last surge of patients who wanted to have hips replaced and knees replaced that are very painful currently and are struggling with their activities of daily living because they need these surgeries. And by being unvaccinated, by not doing the things that Dr. Carroll and others have talked about, we are now here again, where we are having to put this pandemic and this epidemic on the backs of those who may be vaccinated and are vaccinated and need to have surgery. And so what has changed is just that, the number of patients and having to take people to the bedside to care for patients who need and require more staff than a normal surgery patient or a normal medical surgical patient, due to their high complexity, being on ventilators and needing that high level of care. Unfortunately, that's where we're at.
Okay, next question from Patrick for Penny. What are the obstacles you're dealing with in terms of opening up the community test site?
The biggest obstacle that we're running in right now is just waiting for the contract process with the State Department of Health. So, that process goes to their legal, to their contracts people. And so we are waiting on that to come. We are talking with them just over the last couple of days about other potential options if that is going to take much longer. But we have done everything locally that we can do. So we are ready to go. We are just really waiting on that contract from the state.
Okay, we'll take more questions here. I know Dr. Carroll's got to take off here in just a moment, and we appreciate your time today. The next question is actually directed at Kirk and Aaron, but I'm going to take moderator's prerogative to answer it here because this is something that I have actually been working on even today. The question is from Patrick McGurr, how many IU students have asked for and obtained vaccine exemptions? That's a number that we are calculating and we are putting together, but I don't have that to hand out today, but we will be getting that out. So I can't give it to you at the moment, but we will have something on that coming up. Other questions as we hit the 1:45 mark. Still have a few more minutes. This is the point, Aaron, where we usually do show tunes. If you want to chime in.
I have to go in a minute anyway, so it's perfect. But I'm happy to take a last second question. Yeah.
Chuck, there is there was a question there to Mayor Hamilton about the governor's mask mandate.
There sure was. Yes, that's right. I skipped over that trying to get to the Aaron questions. So trying to find it again. This is moderator's
132.
prerogative for finding where he is. Yes, for Mayor Hamilton, do you think, this is from Adam Pinsker, Governor Holcomb's resistance to instituting a mask mandate statewide is contributing to increases in deaths and positive cases?
Short answer is yes. I think, as Dr. Carroll said, the safety measures add up, they multiply, and everything we can do helps protect against the spread of the disease, which is taking Hoosiers. I know the governor is having to balance a lot of things, as we all do. And I want to say, I guess, on the one hand, we continue to appreciate Indiana government recognizing the importance of local tailoring of rules and being able to set, for example, our local mask mandate. I think it's still the only one in the state, as far as I know, from counties. Maybe that may not be right, I'm not sure, but it's certainly one of the few, and we appreciate that. I would say as well, however, that the state level restrictions, some of which are legislative, those signed by the governor, some of those restrictions, for example, on requiring proof of vaccination are very detrimental from my perspective to our ability locally to protect folks. And we've seen states across the country vary. I put Indiana kind of in the middle, but it would be better if we were on the leading edge of the most protective steps, which seem to be making a difference in states that have achieved high vaccination, that are really avoiding the politicization and the lack of masking. So on the one hand, I appreciate the amount of flexibility we have on that, but I also do think it's at a position where some tighter controls would be helpful.
Okay. Now I'll make a call for other questions if there are any. We still have a few minutes left, and happy to take one or two last questions here as we approach the 2 o'clock hour. And again, just to let you know that we are doing these weekly. Next week, we will be back at the same time and planning to do weekly for as long as conditions warrant. So you can join us again then. And of course, we'll have a release out from the city coming the morning of with the link information as per usual. So not seeing any others. So I'm going to make one last stretch out, talk very slowly because we still do have a few moments. So not seeing any, we'll give you a little bit more time to your holiday weekend. Thanks everybody for joining us. Thanks for your questions today.
Thanks, everyone. Get vaccinated.
Thanks, everybody.
Celebrate safely, everyone.